Welcome to Chit Chat with Gina, your host Gina Barbera. Today we are visiting with Dr. Donna Becker, who's had an anti-aging practice for over 20 years in San Antonio, Texas. And we also have Rebecca Henderson, who's been her patient for over 17 years. Thank you, ladies, for being here. I really appreciate your time, and I'm so excited just to learn a little bit more. So, Dr. Becker, I'm just curious. You've been in San Antonio now for a little over 20 years doing the anti-aging, and I'm sure you've seen a lot of different changes and so forth that have happened in your industry. Is that right?
Yes, I am passionate about hormone replacement for everyone. It's not just for the young adult going through perimenopause, but it's through all life stages. Rebecca exemplifies the young entrepreneur. She had to start on hormones kind of earlier, and so taking hormones has been helpful to her in her life. She's a very career-driven individual. So we know that estrogen helps memory, testosterone gives strength and energy, progesterone aids sleep, and without hormones, life is just difficult, I think.
So I'm just curious, Rebecca, so how did you come to discover Dr. Becker?
Well, actually, I was 30 years old and I was getting a full hysterectomy. I had had stage 4 endometriosis and I had a lot of other just chronic problems that nobody could figure me out. And I had seen an article in, I think it was Stone Oak magazine, so I saw an article about her, and I knew I was too young to not have hormones, so I gave her a call. Yeah.
So 17 years later, so how has she changed your life?
Oh my gosh, it's more like how has she not changed my life? So for one thing, I feel like I'm 30, I'm 47, and she didn't just help me with balancing all my hormones, putting them in the optimal level, versus there's a lot of doctors that do hormone replacement, but aside from like synthetic hormones, these are natural hormones, and she puts you in your optimal range. So sometimes like the range can be kind of big. I didn't feel good at just any range. I felt good at like on some of the hormones on the upper side.
Really?
Yeah, and she also doesn't just do bioidentical hormones. She also she's like a whole body doctor. So she found a lot of things that I wasn't even aware of and recommended like certain supplements that have changed. I have more energy. I can think better. Like I said,
you look fabulous.
Thank you.
You really do.
Thank you. And
Wow.
it keeps me, honestly, it helped me be like a better mom, because when you feel good, you're in a better mood, and
And especially, so kids can sometimes be a little bit, draining and energy. You need that extra energy.
So career-wise, I feel like I can focus better. That's a big deal because, the sharper you are, the more productive you're going to be.
So Dr. Becker, when someone comes and visits with you, what do you do? How do you help them?
Well, first of all, I get a very in-depth interview with them. I want to know about their life, their struggles, what is it they need, what problems are they having, and I look at 3 pages, single-spaced lines of labs that help guide therapy. It's not just the labs, though. I need to know the person's main problem, or what is their main desire for a hormone replacement. What brought them to me? What do they expect? What do they want? Some people want to be able to think more clearly. Some people are very much want their libido increased. They want their sexual attractiveness increased. They want to have more energy, more stamina. Rebecca wanted everything.
I wanted everything. So you're mentioning all this. I'm like, well, why wouldn't I want energy? Why wouldn't I want a libido? Why wouldn't I want sharper thinking? So, and that's exactly what it did for me. Everything she's saying, it was like night and day. And also she helped me get to the root of, so I had stage 4 endometriosis, which is, so
estrogen dominance.
Yeah, estrogen dominance. So we corrected that, and we corrected several other things.
So Dr. Becker, a lot of times people think going through hormone replacement therapy is maybe for women that are going through menopause, but you were in your 30s.
Yeah, and I'm 47, and I must at least every day shock somebody. I'm 47, and I feel amazing, and I mean, I feel sharp as a tack. That's like a big deal because at the time I feel like I had a lot of like fogginess going on in my mind.
Okay. So is that typical, Dr. Becker, that someone in their 30s would come to you, or is that something unique, or?
It's all life stages. I
Okay.
see people as young as in their late 20s. Rebecca didn't have that problem, but I've seen people with premature ovarian failure. That's when the ovaries just stop working. So menopause can begin just about almost any age, and perimenopause many years prior to the full, ceasing of the hormones being released from the ovaries. But sometimes people just come to me with other problems, and that's where all the lab work comes in. It's B12, homocysteine, a toxic blood marker for Alzheimer's and heart disease, C-reactive protein, all the labs. It's been amazing how many people are even simply anemic. They have heavy periods all their life.
Can I interject something?
Yes.
So she helped me a lot with my thyroid because like thyroidism, I have Hashimoto's disease and a lot of women have it. And I was getting synthetic treatment at the time, but I was still having all the symptoms of thyroid. So we were able to switch me to something more natural.
Okay.
And it's like night or day. And I'm
Amazing.
not cold anymore. My hair stopped falling out. So
That's awesome. Wow. So I'm also curious, Dr. Becker, since you're able to help with even these other types of things from thyroid, are there some of your patients that actually just use you as their primary doctor for their checkups and stuff? Is that even possible with you, since you go in such in depth about blood work and
I
all
ask that people keep their primary care physician because I'm really not able to see them, for acute minor illnesses. I just have too many other patients with hormone-related problems.
Okay.
So, but where I'm needed, where they ask me for help, I will help.
Okay.
But if someone's in a car accident the day before and they need to be checked by their family doctor the next day, it's better that they have a primary care doctor on board.
yeah.
Okay.
And I do want to say that she has this patient portal, which is amazing because I can communicate like very freely with her. So I could put in like a message to her on the portal
that's
and get a response pretty quickly.
Okay.
So.
Okay. So I'm just curious, what would be something besides what you've told us that you want people to know about Dr. Becker?
Well, for one thing, she's very sincere, she's very caring, and she listens. So she's got a great bedside manner. Unfortunately in my life, I've been to way too many doctors, but not so much anymore, primarily her. And she really listens, and her goal is, as I mentioned earlier, is to put people in their optimal levels because it seems like there are just so many people that are talking about hormones now. And she gets to the root of the problem. Like she mentioned, was it homocysteine and like Alzheimer's? So that's always been like a big concern of mine is I don't want to get that because, it's nothing good about that. So.
Okay, well, thank you. And then, Dr. Becker, is there any new studies or findings that you want to share that might be new to the anti-aging practice?
I just want to say that one of the things that really troubles me is when women come to me and say, my doctor said I'm too old for hormones, and they just take a woman who's maybe in her late 50s or early 60s, he just stops all her hormones, and then she just feels like her world has crashed, and she's very despairing. I even had a psychiatrist refer a patient to me because her doctor had withdrawn all her hormones based on the fact that she was in her late 50s.
Wow.
So I replaced all her hormones naturally rather than the synthetic ones she was taking. And, she became more stable. And so hormones are not just for energy and libido, but it's very important for your mental state.
Yeah.
Okay.
It takes away anxiety, helps you to be calm, aids sleep, gives energy. I think, there has to be a balanced discussion with the risks, side effects, and the balances of the hormones. How important it is. That's why the first, meeting with a patient is sometimes 90 minutes, and I have to go over their history in depth and talk to them about that taking hormones is a lifestyle choice. They can continue to live. I personally don't think as well as they would live with hormones, but they need to know there are other options as well.
And these are natural. Like the
Right.
bioidenticals, it's not the synthetic ones, so that's like a big deal.
And it's to your blood levels too, so it's not like a
Yes.
cookie cutter,
Yes,
right?
everyone gets a different mix of the hormones. The despair of the pharmacist sometimes.
Well, I just want to encourage anyone that is watching this that would like to get some more information. Dr. Becker also gives a 15-minute free consultation.
Yes.
Is that correct?
Because I need to talk with people. Sometimes, they have other expectations, and I will refer them to someone that might be more appropriate. So I think a 15-minute consultation is good for the patient and good for me to see if I think I can help them, and for the patient to think, oh, I think I could work with her.
Okay. All right. So we just want to thank you for joining, and please see the number that you can reach out to Dr. Donna Becker. And thank you, Rebecca, for being here. And I'm
Thank
just
you for
amazed.
having me.
For 17 years, that's a long time and faithful patient. So
Well,
and
there's
you
a
look
reason.
fabulous. Yeah. And Dr. Becker, I mean, you're what, in your
75.
75? Can you believe that? And she's a sharp, and you're just still working hard. So
Yes.
yeah. So make sure you get in touch with Dr. Donna Becker. And thank y'all for joining. Bye-bye.
Bye.